What is Gardnerella vaginalis? Gardnerella vaginalis is a predominant anaerobic bacteria that is part of the normal vaginal flora. In a normal condition, the Lactobacillus species predominates the vaginal flora. However, when Gardnerella vaginalis overgrow and dominate the vaginal flora, this imbalance results in bacterial vaginosis known as BV. BV is a condition caused by an overgrowth of bacteria in the vaginal flora. It is associated with preterm birth, infertility, endometritis, and higher risk of acquiring human immunodeficiency virus, HIV, and sexually transmitted infections. In 1953, first reported as Haemophilus vaginalis, but later studies revealed that it does not meet the requirement of Haemophilus species. Later, 1955, the bacterium showed a positive Gram stain and was reassigned to Corynebacterium genus and renamed Corynebacterium vaginale. 1980, studies by DNA hybridization and variety of biochemical methods show that the bacterium is lack of similarity with any previous established genera, and lead to the proposal of new genus, Gardnerella, that was named after Hermann L. Gardner, and the bacterium is Gardnerella vaginalis. Next, the origin and what possibility that has caused to this infection. Normally, the vagina contains lactobacillus bacteria, which produce lactic acid and hydrogen peroxide. By creating an acidic environment, it is inhospitable to many pathogenic bacteria and yeast, thus inhibit their growth. However, if there is imbalance in vaginal flora, it lead to shift of bacterial population. The population of Lactobacillus species can decline and change the vaginal environment to high pH. This change favors the growth of anaerobic bacteria, Gardnerella vaginalis. Gardnerella vaginalis overgrow and predominate and lead to bacterial vaginosis. The causes of BV: multiple sexual partner, vaginal douching, frequent tub bathing, use of over-the-counter intravaginal hygiene products, smoking, and lastly high stress level. In worldwide, the prevalence is most common in parts of Africa, and least common in Asia and Europe. In the United States, BV rates are approximately 30% and vary between different ethnic groups. The lowest rates of BV are in Australia, New Zealand, and Western Europe. Meanwhile, in Malaysia, according to Khairi Yunus, 2017, 77.3% cases of BV were identified by using AMSL clinical criteria, while by using Nugent's Gram stain, it shows that 30.9% cases are positive for BV. The pathogenesis. It is known that Gardnerella species have virulence factors such as hemolysin, mucus-degrading sialidases, and capability to form biofilms, which contributes to their pathogenic character. In the first pictures, shows normal condition in which the lactobacillus dominated the squamous epithelial cell and also covered with mucus layer. In the second picture, lactobacillus creates healthy vaginal environment by producing the antimicrobial peptides properties, anti-inflammatory cytokines, and lactic acid. However, in third picture, the colonization of Gardnerella vaginalis species displace lactobacillus, results from imbalance in natural bacterial flora. Lactobacillus species will deplete and Gardnerella vaginalis dominate the surface of the vagina epithelial cells. Fourth picture, the presence of Gardnerella vaginalis creates the symbiosis between other anaerobes that associated with bacterial vaginosis. In the fifth picture, the production of sialidase by Gardnerella vaginalis lead to degradation and disrupts the protective mucus layer and epithelium. Sialidase activity contributes to the formation and stability of bacterial biofilms. Biofilms structured embedded in a protective extracellular matrix and shields the bacteria. In sixth picture, due to loss of mucus layer, it facilitates the BV-associated bacteria adhesion and colonization of the vaginal epithelium. The seventh picture is secondary colonizer in the vaginal microbiota. When the bacteria proliferate and overgrowth, it stimulate the host response. The receptor of host immune cell recognize the bacteria and triggers the production of pro-inflammatory cytokines and chemokines. Later, these signaling activate the immune cells to the site of infection. Lastly, the last picture is the final stage of BV, associated with the presence of clue cells, which act as a hallmark for diagnostic feature. Clue cells are the epithelial cells that heavily covered with bacteria. The sign and symptoms. Vaginal discharge with fishy odor, thin gray or white vaginal discharge, lower viscosity vaginal fluid, itching and burning sensation. Next, vaginal pH, presence of the diamines putrescine and catevine, detection of sialidase enzyme and depletion mucosal sialic acid. Cytomorphological and characteristics. For normal vaginal flora, blue, thick rods known as Lactobacillus species or Doderline bacilli. Appears to be a singular organism but in abundance. Causes cytolysis in navicular cells. Presence of bare nuclei intermediate cells and fragments of squamous cytoplasm. Normal characteristics of the cervical cells. Bacterial vaginosis. Presence of clue cells that has a velvety coat or shag carpet appearance, caused by the Coccobacillus, Gardnerella vaginalis. Lactobacilli and inflammatory cells are absent. In conventional smears, appear filmy or sandy background. In liquid base has cleaner background. Does not cause inflammation to the squamous cells but perinuclear halos are seen. The left pictures show normal vaginal flora and the right pictures show bacterial vaginosis with hallmark appearance of clue cells. Bacterial vaginosis and its complications. It may cause endometritis and cervicitis. Bacterial also can migrates from lower to upper genital tract, which cause pelvic inflammatory disease, infection of female reproductive organ, second, post-hysterectomy infection, surgical site infection and antibiotics used affect the pH balance, third, tubal infertility, cause damage to the fallopian tube and impair the function. For pregnant women that diagnose with BV, it may cause amniotic fluid infection, intrauterine fetal death and risk of preterm labor. Suggestion for bacterial vaginosis is, repeat smear after antibiotic treatment. Treatment. Oral metronidazole, 500 mg twice daily for 1 week. Metronidazole gel, 0.75% strength. Apply 5 g of gel once daily for 5 days. Clindamycin cream, 2% strength. Apply 5 g of cream at night for 7 days. Prevention. pH regulation, take lactic acid and vitamin C, probiotics, oral lactobacillus supplement.